Okay, we're listening now.
Great, thank you.
Okay, everybody focus.
Yes, this is the February 8th, 2021 Board of Health, Fairfield Board of Health meeting. We'll call the meeting to order at, we switched over from the WebEx that was originally on the agenda to just audio only, the phone number of which was on the agenda. Just to take roll, this is Henry Yoon. Ms. Conley, are you there?
I'm here, yep.
Great. Dr. Hotchkiss?
Yes.
Mr. Steno, are you there?
I'm here.
Great. Dr. Morozzi, are you there?
Yep, I'm here.
Great. Ms. Vitale?
Yes, I'm here.
Fantastic. Has Ms. Sturgey joined us yet? No. Mr. Cleary?
Yes.
Great. Ms. Mitchell, are you there?
Yes, I am.
Great. Ms. Flynn?
Yes, I'm here.
Okay. Well, thank you. Is there anyone else on the line? All right. Fantastic. So if we go ahead and move through our agenda, hopefully everyone had a chance to take a look at the meeting minutes from our last meeting in January 11th, 2021. Does anyone have any comments, questions, edits they'd like to bring up? If not, if I can get a motion to approve the minutes.
Motion
Sally
to approve.
Conley, I'll approve the minutes. Okay.
Thank you, Ms. Connolly.
And I'll
Dr.
second it
Hotchkiss,
as Mark.
thank you. Seconded. Yep. All right, fantastic. Just for the sake of, since you can't see me doing this, but yes, all those in favor? Any opposed? Any abstentions? Great. Thank you. Let's move forward to our Director of Health report, Mr. Cleary.
Sure. So I had a fantastic visual presentation all set up, like usual, but...
Hey, Stan, you're
Yes.
super echoey. I don't know if you're on a speakerphone or headset, but if there's any way to
Is that better?
Yes, a million times better. Just rein in the frequency. Beautiful. Thank you.
Hold on. Let me switch to a set of headphones here.
I think it might help
know.
if we all also mute for the
Yep.
echo.
Is any better? Is that better? Can anyone hear me?
Yes.
Yes.
Oh,
Yes, unmuting to say it. Much better. Thank you.
Okay. So I just I'll do a quick overview of some general statements. So on the CDC conference call, the CDC said today that in general things are getting better. Things are improving in terms of the numbers that we're seeing, and I'll just that cases, percent positivity, new admissions to hospitals are all declining at the federal level. State, deaths are holding level at this point, but they expect them to begin decreasing soon. At the state level, we're seeing the same kind of situation where we see things improving across all different metrics. The level of activity, is still at a very high level. Much more so than what was experienced in the April first wave, but things are all trending in the right direction and getting better. At Connecticut, there's really nothing at this point that's overly concerning, other than just they continue to increase testing regarding the variants. Today on one of the state conference calls, they still said the presence of the variants in Connecticut is very low at this point. That we're not seeing what some other states are seeing, but that there's this potential that this variant could become the predominant circulating strain in the next few months. So that's a general overview of what's going on. We are seeing locally the same kind of thing going on. The one thing that we have seen that's a little just of note, a little concern, is that the average age of the median age right now in Fairfield is about 20, which has been coming down, indicating that there's more cases amongst younger individuals. So that is one thing. But again, the numbers are all trending in favorable directions with regard to local data as well. To continue on in the COVID aspect of this, today the governor announced that we will, as of Thursday, those 65 years old and older, 65 to 74, can now be added to those eligible to be vaccinated as of this Thursday. They did kind of put this unique language in there that said, but if you have space in your clinics this week, that you can fill them with those 65 and older. So with that news, not that we did anything, we've already started to see our appointments start to increase. So we were relatively full. We are full this week, relatively full next week. We had about 60% capacity on the following week. And then we had just posted last Friday the 3rd and the 4th of March, and we were, at about, 200 out of the 1,000 appointment slots were, 200 out of the 1,000 appointment slots were booked over the weekend, which is, a lot of the first dosers from the clinics that we had this past week. So right now, we're looking at, we're seeing that those appointment slots are now rapidly filling up. We're almost completely full up until the 3rd and the 4th clinics, and those are quickly filling up. I think we have, out of all of our clinic, we've got 4,032 appointments over the next, including this week, over the next 4 weeks, and 463 spots of those are open. So a little bit more than 10% are still open. And of those that are currently booked, the 3,569 that are currently booked, about 900 of those are first doses and 2,700 are second doses. At the state level, we've seen about 517,000 total doses administered in the state, with 387,000 first doses, 129,000 second doses. So what will be happening for us over the next few weeks is really just trying to provide capacity for that 65 to 74-year-old age group. So some of the things we've done since we last met, we were at about 1,850 doses administered last time we met. Right now we're at 5,857 doses administered. And we're at the end of this week, we'll add another 1,000 to that likely. And then we will, lost my thought there. We will continue. We're looking for ways to sort of add additional capacity, but it's all dependent upon vaccine supply. Vaccine supply is getting more challenging as more vaccinators come into the state system. So Yale and Hartford Healthcare are operating large facilities. CVS and Walgreens are being supplied by the state. with vaccines, so that comes out of the total state allotment. And what's coming online soon is Walmart will be doing it at seven locations throughout the state. And what will be happening as of this Friday, there's a federal pharmacy agreement to where the pharmacy chains will get it directly from the federal government, and that'll start. They're predicting this Friday with 60 additional sites in the state of Connecticut. So there'll be many more opportunities for vaccination coming up, and so as additional providers become available, Connecticut providers become available, the demand on vaccine becomes more. So our allotments are potentially going to get smaller. So we hope to be able to fulfill all these appointments that we have. We've heard cases of other towns and cities having to cancel scheduled appointments due to lack of vaccine. And so we will continue to work to secure as much vaccine as we can get, but it's largely dependent on what the state gives us and what we can secure, borrow, and beg from other towns around us. So the 65 and olders will definitely be add some additional challenges to us, but we've got good systems in place where we have set up since we last met. We've set up a call center, COVID call center for the town of Fairfield, and have worked with the new senior center director is coordinating that effort on the town's behalf. She has called upon CERT volunteers to staff that, and so we meet with those CERT volunteers. A couple of our staff will meet with them to go over different questions that aren't being they don't have the answers to right off the bat, but they've really it's been very impressive. They've been able to get into VAMs, be able to walk people through how to sign up for VAMs, be able to look for different appointments in VAMs, to tell them where they need to look to find open spots. They complete an online survey with them to enable them, those who don't have the technological capacity can simply call in, and they will walk them through the questions that one of our staff developed a survey that walks the call center staff through all the questions they need to ask. And they also, so that's for those folks who don't have the technological capacity. And then they also, the folks that are homebound can call that same number. And so last week we had our first clinic separate from our regular scheduled clinics this past Friday, where about 75 individuals that didn't have that technological capacity were brought through a clinic, a different type of clinic in the VAM system, a third-party clinic, which is just a different way to set up a clinic. And then starting this week, we are going to hope to address the individuals that are homebound and deliver vaccine to them. So we'll have our MRC nurses and volunteers and potentially our town staff and volunteers going out to reach those people that are homebound. And so the call center continues to take those surveys and calls. We'll continue to develop a list, and as we get as the number becomes larger, we will set up a clinic to address those individuals and try to meet those needs. And that the call center and that system is just where we're bringing those individuals in is just for Fairfield residents, while our clinics are open per state requirement, open to anybody. Those particular clinics are just, since we're doing that extra legwork, are just for Fairfield residents. So, and then, on the town side, just we continue to, continue to work. We have a couple of new endeavors starting with a new database that's going to be rolling out in the next, it'll probably take another year. Well, we had one of our first meetings of they've, selected a contractor that will start building out a new database, new permitting system for the town. So we'll be working with that. And We did submit our budget to the First Selectwoman's office and had the first opportunity to meet with the staff of the First Selectwoman's office and the finance and respond to any questions about that. Our budget is essentially level from last year, other than contractual obligation increases due to union agreements. So we didn't ask for any additional funds. We are at this point just trying to utilize as best we can all the available COVID-related funds that have been made available to the health department. Which again presents its own list of logistical challenges and administrative challenges, just trying to manage all these and manage all the staff that we're bringing on. So it remains quite a challenge. So that I'll leave it at that and open it up if anybody has any questions about anything in particular.
Hi. Sally.
Which will always have a comment on everything. Thank you so much. I appreciate it. So a couple things. Thank you so much. I think, I was there last week, FYI, for vaccine number 2, Moderna on Wednesday, and I've been doing my Facebook posting and trying to be a positive messenger on that, and I actually had no side effects. I know tons of people did, but I didn't. One thing I did want to bring up, because you're talking about the issue of really bringing it out into the, and I'm sorry I'm on the phone, I feel like I get a little feedback right now, but you're discussing how you were trying to put out the possibility of vaccinating within the home for the homebound population. So because I am in home health care, I got an email from the director of Bigelow just today, actually, requesting that we really get the message out to the public if we have any patients. And so I just want to let you know that I put it out on Moms of Fairfield, which is 10,000 people, and very specifically said if a member of the public basically covers these 3 parameters of being a resident of Fairfield, is 75 plus, and is homebound specifically, which means this isn't convenience. This isn't like I don't feel like dealing with driving a family member to the vaccine clinic, but this is someone who is truly homebound and doesn't have another person or has a mobility issue. I actually put it out there, and I just want to let you know that I was actually contacted to take that post down. So I actually want to address that specifically because I have an issue with that, because when you brought up the Seaside Park PCR testing, I've been on the weekly Norwalk Hospital care coordinator meetings, and we often find how to get through the red tape a little bit, and I put that out into the atmosphere a little bit, and many friends and residents of Fairfield had said, wow, we've been able to get through the red tape because of X, Y, and Z. So my question for you is, we're trying to help people, right? And basically cast the net for the people who are homebound, but I have a little bit of an issue with, are we helping them or not? And can we promote that or not? Because just saying, that's what happened today, and so I'm a little bit irritated. So I want to ask you, Sans, I feel like it was 100% appropriate for me to throw it out there into the atmosphere that anyone who knows a neighbor who might not have a family member who is 75 plus and homebound and lives in Fairfield should contact our director at Senior Services in Bigelow. So I want to know actually your feedback on that.
So I would, I don't know who asked you to take it down.
She asked me to take it down.
Okay. So it's Julie at the Senior Center or Brenda Steele?
It was Julie, and it was clearly that I, quote, said there was a mobile clinic, which was not mentioned anywhere in the post.
So what we've been directing people is to call the COVID call center, with questions about vaccination. And so I would direct calls like that to that call center, which is on the town webpage. But it's 203-256-3082, and that's the pathway. That's the pathway.
Understood.
For people to get on.
However, I just want to point out that when it's put out into the healthcare world, that there are people who need. We are starting to create a list of homebound 75-plus seniors who live in Fairfield. Please let us know those people. I don't want to be scolded for giving the email address of a public official that you can Google. So I just want to throw that out there as an issue.
Yeah, I can't answer to that. I mean that you're free to post on
my
Facebook.
Point is this: are we helping people? Are we casting the net to help as many people as we can? Or is it inconvenient when too many people request assistance? That's my question. And I know I'm being confrontational, but listen, it's been a week, okay? And we'll get to the rest of that later.
Sans, this is Andrea. Do you mind if I just have a brief statement about that?
Well, I guess it's not, it's not really open to public comment right now,
okay.
I guess.
I think it's just
Sally,
the number of calls that are coming in to be directed and handled, like the calls that came into our office, we're all funneling everything to the call center so it's addressed so it doesn't get lost. I think that's the only point I wanted to make.
Yeah. Well, no, and I hope that's what came across in my reply, is that, yes, Sally, we are trying to help the greatest number of people, but they should be directed to the appropriate resource. And so right now, the town has set up this call center for just that purpose. And so sending them to
which
Julie
I
DeMarco's
understand, but
personal
I just
email.
want to let you know that as a health professional, I got an email from our director of Bigelow Senior Center that said to contact her directly if we had anyone we knew who would be eligible for that situation. So all I'm saying is I don't want to be scolded for dissemination of information. That's my point.
Okay, so I guess I'm a little confused. So Julie sent out a communication that said to contact her directly?
Yes, that is correct.
Okay.
It was to all of probably people from the Bigelow Senior Center list, which I had been attending the meetings for the last couple of years. It used to be probably every other week, and then it transitioned to once a week, and then it completely stopped during COVID. But so everybody on that mailer got a list today. So thinking that I'm helpful, I sent out a message into the social media atmosphere, which can be very helpful for people who don't get dissemination of regular information. And that was the first time of all of the COVID communications where I had been basically chided to remove information ASAP. So I'm just letting
Sally,
you know that.
So I'm sorry, just not to. I just want to make a comment. So I think I don't want to answer for Sands, but Sally, I think we all recognize the importance of getting helpful and accurate information out in the community in regards to, particularly for our vulnerable populations. I'm not exactly sure where SANS and the health department fall into this discussion. If you'd like me as the chair of the Board of Health to reach out to anyone and echo what I've just said to you publicly, which is I think it's very important to get the messaging out there. We want to be as accurate as possible, and how is it that the health department can help in messaging? I'm more than happy to do that, but I'm not exactly sure. And Sands, if you feel as though that you can help in another way, please feel free to chime in. But I'm not exactly sure how Sands is going to help here.
Right. No, I'm just making a point. I just want to let you know that this is the email as stated said, "Good morning, everyone. We're working with the health department to create a list of homebound Fairfield seniors ages 75 plus who live at home and have been unable to access a vaccine. If you have clients who are homebound, truly cannot get a ride or physically get to or through a vaccine clinic, would you please let us know? The town is working out a way to deliver vaccines to homebound seniors. At this point, it's still 75 plus, and for the truly homebound. Thanks, Julie." I just want you to know I got that email this morning, which was via the health department, disseminated the information because I felt it was important, and was told to remove the information. So that's my point.
I understand.
Okay, I'm sorry.
I can just talk to Julie about it and see what her reasoning is.
Sands, it's Carolyn. I was late getting in. I'm sorry. Is there something I can do? Because I didn't get any of this information from Julie at all. No email or anything, and I'm on the board. I'm on the board there.
Well, Carolyn, I think it was that email was targeted to a specific group of individuals of
okay. Well, see, I came in a little bit late. I'm sorry, I didn't get the whole thing.
Right.
But I'm very concerned about it.
My point is that you addressed it in your presentation, that I got it, that we helped with disseminating it, and was scolded for putting it out there. So I would like that to be addressed, because I think it was inappropriate for there to be scolding for helping to basically widen the cast of the net of people who would potentially benefit. As
I gotcha.
All of us have a neighbor, okay? All of us have a neighbor who is alone, okay? And if you think that everybody is clued into Bigelow and gets the emails, they don't.
So Sally, I'm just gonna ask us, maybe why don't we wrap this up for the time being and give Sands a chance to collect what information. I think it's noted your point, and there's certainly some validity to that. But as opposed to asking Sands questions that he doesn't have any information about, if we could acknowledge your comments and your perspective, certainly being a valid one. And Sands, if you have enough information where you could move from here and just get a little bit of clarification, how we can get the
so my question will
appropriate
be
information.
Sands, if you could follow up on that, that would be super great. Okay, so that's my question.
Yes, of course. That's what I said in my response. I will talk to Julie.
Thank you.
I'll see
Perfect.
why she wanted it taken down, and I'll have her
Thank you.
Hopefully reply to you to address it.
Great. Thank you.
All right. Does anyone else have any questions for Sands? All right. If there are none, Jill, your report?
Not much to report. I mean, there's progress on a few fronts. Last week we met with the athletic directors and Dr. McDonald, Sands, and myself to discuss the resumption of interscholastic competition. And based on the downward trend in the school learning model indicators, it was decided that we would, that the athletic department would proceed with interscholastic competition that presumably began yesterday. No, is today Monday? I guess it's today, just today. Todd Parnes, the athletic director of Fairfield Ludlow High School, reviewed numerous mitigation efforts that he was going to have in place. It was nothing unusual. It was all in the SEAC report. And that information will be passed down to the coaches who will ultimately be responsible for maintaining those mitigation efforts during practice and play. The other thing I'd like to talk about were the elementary schools who are back 100% in person from 9 to 1 every day, Monday through Friday. And because of that and the increased person density, we did institute the whole class quarantine, which we've done. That started January 19th. And to date, we've had to quarantine 7 classes, none last week, and actually all of their quarantines will end today. And thankfully, there have been no cases of reported positive testing. So we'll just take that information. Again, that supports what's been fairly widely accepted, I think, for quite some time, that there's relatively low in-school transmission among students. And we're just going to continue collecting that kind of data. Overall, the incidence in school has dropped down, as it has dropped down in the country, the state, in the county, the town, the state, the country. And I cannot figure out what that is due to. Is it increased mask usage? Is it the introduction of the vaccine? It seems to have taken effect rather quickly, but I'm all for it. Any sort of downward trend and getting back to resumption of normal activities is a good thing. And that is really about it for me.
Great. Thank you, Jill. Just a follow-up question about sports.
Yes.
Do you know if what the stance the stance is on spectators?
I'm sorry, I missed the last part, Henry. What was that?
Oh, spectators. Spectators.
Oh, no fans. No spectators, okay. No fans.
So
yeah, I would agree with that.
I'll add to that. The position of the State Department of Public Health is no fans. The position of the CIAC, the overall Connecticut Athletic Conference, is that there should be no fans. And the FCAC, the Fairfield County group, said no fans, but they kind of put a caveat on that for now, that they're going to start off the season with no fans at this point. And so that was the decision there. That was our recommendation as well, is that there be no fans.
Great,
Hi, it's me. Hi, it's Sally. So a couple questions. So one is, so we all watched the Super Bowl the other day, like last night, where there were fans. So how are we figuring out the balance of having fake fans, like fake people in the stands, and actually allowing people to be spectators?
I think we just said that there are no fans allowed at this time.
Okay.
Yeah, I think what the is Mark. I'm sorry. I think what the professional sports decide to do is sort of. I mean, I think we should go by what the state and the town and the county have decided. I think that's reasonable for right now, at least. And as Jill said, I think it will reevaluate it. But I think what we see on in the world of the NFL, I'm not sure that they made the best decision. That it's yet to be determined. But I think for now, I think it makes sense to get started. I think the kids should be able to play, but I'm concerned if there are a lot of spectators, that's going to potentially create a problem that if we can avoid, especially now that things are starting to get better. I'm sorry, I just wanted to say that.
Okay, so my next question let's see, I have a couple questions, but so another question that I have has to do with the quarantining, and I know we discussed that. You had given a good, solid response, and I didn't respond to it directly, Jill. But just regarding the quarantining, every time we have a meeting, what ends up emerging is the fact that basically nobody becomes positive based on the quarantining. So my concern is that there is like an overly conservative approach to the quarantining. Initially it was like the 6-foot distance for 15 minutes, which I get, which is why there were just like, a person here and there in a classroom. And then all of a sudden in recent weeks, it's been an entire classroom. It seems less because of the fact that there's actually students within a certain proximity of the positive student, and more because a teacher is not feeling confident to say that the student or that no student would have potentially maybe kind of sort of been near the positive student. So I have a little bit of an issue with that because having an elementary schooler, they're in their seat and they have a set seat and they have their little place in the room. They're not allowed to go basically anywhere the entire day. So I'm trying to really understand how there was this change from
that's right.
3 people being in quarantine to an entire classroom, and I have a major problem with that, and how disruptive it is to full-time working, 2-parent household working parents. I have an issue with that.
Mm. Okay. Do you have a question?
Yeah. So my question is, why are entire classrooms being quarantined based on one teacher saying IDK, basically, when all of the students have set places in the classroom and basically can't move from point A to B, because that's what's happening with my 10-year-old. So I think it's total nonsense, personally.
Okay. The teachers that I have spoken to have not been able to do that. They describe a classroom environment in which the children are not necessarily free to get up and move around, but there is movement in the classroom. They do use the small group settings at a small table with various combinations because of reading groups or math groups or what have you. I do hope in the older grades at least, 4th and 5th grade, that the seating would be more, as your son is. I guess he's a 4th or 5th grader. Sally?
5th grader.
Yeah, I would imagine that in those grades that the children are, less mobile.
No,
that's
not true, by the way. In 5th grade, you actually should be rotating between multiple classrooms. That's like the setup of a 5th grader. So,
typically,
that's what I'm
I don't
not
think
understanding.
Now, though, I thought that the teachers were the ones who were rotating, not the students.
Yeah, so why are they even going into small groups if it's unnecessary and we're trying to create a controlled environment? To actually put people out for a 14. But then our school system, and Christine Vitale on the call as a chairman, should be putting out there then, why are the teachers and students rotating into weird small groups when they could have their assigned seats, and then we don't have the issue of a problematic determination of who's quarantinable? That's not appropriate, okay? We all of a sudden transitioned to a 9 to 1, and you, a couple days into it, all of a sudden find out your kid has to quarantine for 2 weeks. That's not okay. That was not. I've been on these meetings every week. I've been on them every month, and that was not the protocol that was set forth. That was an 11th hour determination, and the parameters should have been set in place within the teachers and within Bob Smuller, the FEA president, that stay within your, stay within your parameters so that this becomes a non-issue.
Sally, I made it very, since the beginning of the school year, that with an increase in in-person density, that the number of people quarantining would increase dramatically.
So somehow Burr is like, they're just moving around left, right, and center.
They were in let me see, how many classrooms? The 2 classrooms that I spoke with.
What I think is it's the culture of the school, but that's my opinion on the record. So the last thing that I'm going to ask is a question, because as a Board of Health, clearly the entire focus has been on COVID, but I'm going to put it out there super bluntly right now that December 3rd was 2 months prior. 2 months prior to the day that one of my son's friends committed suicide. So I'm putting it out there, and I just want to remind you all that you're putting COVID as number one. You're putting COVID as number one, and you're not looking at the big picture. Because December 3rd, I wrote a letter to the Board of Ed, to the Board of Selectmen, and to our Board of Health after the other suicides. And my son's friend, who he ate lunch with every day, and he got a ride home from every day, is gone. So I'm pointing that out publicly on this meeting, and I'm calling everybody out, because 2 months prior, you can choose to figure out what the bigger picture issue is, okay? And I'm going to remind everybody once again that I don't know one person in Fairfield between age 5 and 18 who has died of COVID. And I know now more than one who have been affected by it. From the mental health perspective and the isolation and having all of the sports cut out, the lacrosse and the football, gone, eliminated, okay? So I'm calling it out right now, because you need to get the kids back in school and stop looking at all these BS parameters, okay? There are other school systems. Westport is full-time in school. They figured it out. So you know what? Figure it out. Because I would have my kids in school. My 8th grader is full-time in person in school. Figure it out. Because honestly, the complacency is killing kids, and there will be more. And I said it December 3rd, 2 months prior to February 3rd. And now the kid who dropped my son off every day,
Ellie,
is gone.
Ms. Connolly, I will tell you that clearly that this is a significant problem. And I'm sure I speak for the entire board when we wish that this wasn't as difficult as it is. And, I personally am sorry that you and we all have to be affected this way. So thank you very much for bringing light to this situation again. I can assure you that if I can speak for the rest of the board, that we certainly believe that it's an important priority, mental health, and the overall health of all our students and all our citizens. So I am going to echo Ms. Connolly's support and concern for mental health issues within our community. And if everyone could help brainstorm as to how we could better address the needs of our citizens. But you certainly make a point, and thank you for doing that. And we'll certainly bring this back to, hopefully through Ms. Vitale, back to the Board of Education to, again, just highlight these concerns of ours. So unless anyone has any other comments, I'd like to move on to the next part of our agenda. Ms. Connolly, would you like us to take a break?
Or just mute. It's fine.
Sands, can we take, I don't know what the protocol is for just taking a recess. Can we do that?
Yeah, I mean, you can call for a break if you want. I mean, I imagine we should all just stay on the line.
It's okay. It's okay. I'll just mute. It's fine. I know everybody's busy. I'm just going to mute. Okay? Thank you.
All right. Thank you. Sands, are there any communications?
I have none.
All right. Any old business you or anyone like to bring up?
I have none.
All right. Any new business to discuss?
I have none.
All right. Well, in that case, can I get a motion to adjourn the meeting?
I motion to adjourn.
All right.
Second.
All right. Thank you. Again, I appreciate everyone's time. This is a very trying and difficult time for everyone and for all of us. So I think what's most important is that everyone takes some time to support each other because, as you've heard time and time again, we're all in this together. So I want to personally thank all the board members and the Department of Health staff for their efforts. And if there's anything I can do for anyone, please feel free to contact me. Good night, everyone.
Thanks, Henry.
Great. Good night. Thank you, Henry. And thank you, everyone, for all you're doing. Thank you. Okay. Bye.
Thank you.
Good night.
Thank you. Good night.
Bye.
Bye.